All right, buckle up, you sick little gremlins, because today we are diving headfirst into the gross and glorious world of boil-popping horror stories. Yes, those swollen red time bombs of pus that people cannot stop squeezing, even though every doctor on the planet screams, "Do not touch that damn thing." But of course, humans being humans, somebody always has to play home surgeon with a rusty safety pin. Now, before we get to the nightmare fuel, let us get the basics straight. Boils are bacterial infections of the hair follicle usually caused by staph bacteria. They balloon up with pus and pressure until you feel like you have got Mount Vesuvius growing on your backside. According to research published in the Journal of the American Academy of Dermatology, improper popping can actually drive bacteria deeper into the skin. Translation: congratulations, you just made that little zit into a flesh-eating monster. Let us talk treatments. The boring but smart option is warm compresses to help the boil drain naturally. Over-the-counter pain relievers for the ache. Maybe some topical antibiotic creams. And when things get gnarly, the real fix is a professional incision and drainage done by someone with letters after their name, not some guy with a paperclip and tequila. Doctors can also prescribe antibiotics if the infection spreads. But oh no, the internet says you can lance it yourself. That is how we get the horror stories. Like the guy in Tennessee who tried to slice a boil on his thigh with a pocket knife and ended up in the ER with sepsis. Or the woman in the UK who popped one on her face and developed cavernous sinus thrombosis, a fancy way of saying the infection shot straight toward her brain. And let us not forget the college athlete in California who ignored a painful boil on his neck until it turned into full-blown MRSA. That little pus pocket benched him for life. The moral of the story is simple. Boils are like tiny ticking bombs. You do not defuse bombs with your bare hands, you call in the professionals. So next time you get the itch to squeeze, remember that what comes out is not victory. It is pus, bacteria, and possibly a one-way ticket to the hospital. Treat it smart, leave the slicing to the pros, and save your DIY skills for IKEA furniture.